Dr. Joel Selanikio is among the physicians who got the Pfizer-BioNTech vaccine. He's an attending physician at Georgetown Hospital and joins us with more. Dr. Selanikio, good to see you. Obvious question, how do you feel?
I feel great. I was worried I might have some of the minor side effects that they mentioned, like fatigue or muscle aches, and I basically did not feel the injection and have not had any problems since.
You didn't even feel the injection? You didn't feel the needle going in?
I did not.
Wow.
The nurse was that good.
Wow. So what is your message to all the vaccine skeptics who are afraid to get the shots? In fact, I've talked to a number of people in recent days who say they're not going to get it when the time comes.
Well, I prefer to focus on the number of people who are going to get it. And that, of course, can include the elderly, can include healthcare providers, other frontline workers, essential workers, et cetera. I mean, I don't think I'm very good, for example, at persuading people who don't want to get vaccinated to get vaccinated. But I think that we can do this simply by vaccinating those who, in fact, are willing to get vaccinated. I also think that we'll start to see differences in the rise of cases, or hopefully in the fall of cases, in different areas that have higher or lower rates of vaccination. And when that happens, that will add to our argument for in favor of vaccination.
And just because we get these vaccines or getting the vaccinations, the 2 shots, let's say, down the road, doesn't mean we stop wearing the masks, does it?
No, it doesn't. And that's for a variety of different reasons. One of the reasons is that we're not sure whether people who are vaccinated can still transmit the disease to others. And so it's possible that I, for example, I'm visiting with some family and I'm wearing a mask all the time, except on this video, because we're not sure whether or not, again, people who are vaccinated, we know that they are protected to some extent from COVID infections themselves, but we're not sure whether or not they can pass the virus to someone else. And so, of course, we want to be careful and cautious and make sure that people are wearing masks until we have that information.
That's a very important message. Let me move on to what we're seeing in the United Kingdom. 2 cases of another more transmissible variant of coronavirus. Both people had traveled to South Africa. Does this concern you?
Oh, I think it concerns everyone. But I think, there's a far cry from concerned to worried to panicked. And I think at this point, we're just gathering more information about the virus. There's no indication so far that any of the changes that we've seen would affect the virus's response to the vaccination. I think that would be more concerning if we were to find that the vaccination might be less effective against these variations. So again, I think the focus right now is that and of course it's very different from a month ago, we have vaccinations that work and we need to get those into people's arms. That's in South Africa, in the UK, and in the United States.
If I could just follow up with one more question on what's happening in UK, Dr. Selanikio, is there actual scientific evidence that this new variant is more contagious and people are getting sicker from it?
I think right now what we have is preliminary evidence. I don't think anyone who's looking at this thinks that what we have is conclusive evidence. And as we've seen over the course of the whole pandemic, you start out knowing very little and you try to make your best assumptions and your best decisions for policy and protocol based on that limited information, and then you adjust those positions as the information adjusts. So at this point, I think what we have in terms of preliminary information is that it certainly appears to spread faster, to be more transmissible than the initial variants that we were familiar with. And there's some suggestion that, in fact, it might be more severe. But I think the evidence so far, and again, all this is preliminary, the evidence so far is more clear that it is more transmissible.
All right, we'll have to leave it there. Dr. Joel Selanikio, take care of yourself.
Thanks, you too.
Okay.